Sure.
Hi everyone, we are live again. This is our health expert series. So today I've got a special guest today, Dr. David Woon. He is an osteopath from the Osteo Place, and I just thought I'd just reach out because right now I'm just trying to reach out to different practitioners and reach out to my patients as well. Because if there's one thing that I've learned in 8 years, I know that I don't know everything, and not one thing works for everything. I'm excited to have Dr. David Woon today. David, do you mind giving a self-introduction and letting us know who you are and what your background is?
Sure. Wife and I have started up Osteo Place with the emphasis of just having a small local business, so keeping it relatively small. Osteopathy itself has been around for a while. So initially we come from Melbourne, and in Melbourne there's a bigger family of osteopathy. In Brisbane, it's a little bit smaller, so a little bit more unknown. And that was one of the reasons why we moved from Melbourne up into Brisbane, just to expand it into Queensland. Osteopathy itself is more of a holistic approach to treatment. So saying that it encompasses treatment-wise soft tissue work, mobilization, manipulation, and more importantly, corrective exercise as well. So it kind of goes, please ignore the dog.
No, good.
Kind of treats everything in general, but let me start again. Osteopathy is more of a holistic form of treatment. It involves treating the entire body in a sense. So we have different modalities that we use, such as the soft tissue work, stretching, mobilization, trigger point dry needling, and joint adjustment as well. Osteopathy is studied at a university level. It's a 3-year double. Mine was a 3-year double degree and a 2-year master's on top of that. And one of the key philosophies of what osteopathy is the body is a unit, the body is a whole. We treat it all together as one. And that's what kind of led me into wanting to be an osteopath. So instead of just looking at, one specific ailment that person has, we kind of encompass the whole body. So looking at the approach that one system cannot be affected without the other systems as well. And this was personal experience for myself growing up in the sporting industry. With certain injuries, I kind of led towards physio more. But one of the benefits of osteopathy is that I was able to see how it worked on me firsthand. And then that developed my interest into saying, okay, maybe osteopathy is a better approach for my body to the way it heals, as it uses more than just, neck pain, treat the neck. But again, in Brisbane itself, it's not as popular, or it's not as abundant as it is in Victoria, where the two main universities are. So it's still trying to get what osteopathy is out there to the people. And I think once people understand that there are more options than just your generic, doctors refer to physios or whatnot, there is a bigger family in Brisbane that is growing in the osteopathic world, which is exciting to see as well.
Yeah.
Exciting to see.
Definitely, because I know we've co-treated a few patients, and you definitely get some really great results, which is why I reached out to you as well. So, what's your background story? Like, how did you get into osteopathy? You said you did sports previously.
Yeah. So I played sports previously. I had a shoulder reconstruction at a young age, at 16, and that led me into the physio realm. So I was seeing a physio quite regularly. And that was the line that I wanted to go. I wanted to become a physio pretty much. So out of high school, I did a health science degree. And through that degree, one of my lecturers was a osteopath. And I had no idea what it was, right? So, but the more I got to know, figure out what osteopathy was, get treatment through an osteopath, it kind of diverted my way towards it. So it was still, the unknown of what it was, but having it work on myself firsthand, it directed me into osteopathy, which is exciting. It was a little bit longer course than what I anticipated,
Yeah.
But thanks to my family pushing me along, saying it will be worth it in the long run, I finally got through there. So I went through it at a mature age. So I didn't start till I was 22. Osteopathic studies.
Okay.
So
Oh, that's still very young.
Still very young,
Yes.
but not straight out of high school.
Yeah. Right. Okay. Oh, that's great. And you guys would you say you guys have a niche or a specialty that you guys have, or mostly chronic pain injuries? Because I noticed on your website you guys treat a bit of PPV as well, vertigo.
Yeah. So Bianca, who's the physio, my wife, who's the physio there as well, she's really big on the neurological side of things. But we do I know the limit to my abilities as well, and that's why we, a strong referral base that you can have, the better, because you can direct people off into certain ways that you see that will benefit them the most. So BPV, yes. My understanding of BPV is the basic level. There are other people out there that we refer to that if it's more, if it's a more complicated case, then it goes off from there. But it's a broad range of what we treat. Mainly what we treat is musculoskeletal issues, sprains or strains, postural discomfort. There are little niches out into the pediatrics, so kids, which we refer off to again. Again, there's people out there that do that full time. So we see the benefit of sending them off to those guys. But in a sense, chronic pain is probably a big one that we do see. A lot of chronic pain sufferers, just because the general path that they take is the physio realm or chiropractic realm, if they're dealing with chronic pain. So they usually come to us because, one, they either get referred to us and they don't know what we do. Right. And they say, a friend told me to come see you because I've had shoulder pain for years, blah, blah, blah. Yeah. So it starts to get into, we see a lot of the chronic pain people because they're at their wits' end. They're trying to get something to happen. So it's awesome to see that, a strong referral base does help us expose ourselves to those people. But we kind of want to be in that first port of call as well. So, when they do go to the GP and, say I've got this chronic shoulder pain, osteopathy wants to be up there as that, you should go see the osteopath. But at the moment in Brisbane itself, we see, just a lot of chronic pain patients.
Okay, great. Yeah, because I think it's very similar with acupuncture as well, that same situation, like the bench warmer, like you tried everything else short of, short of the palm reader, like, okay, go try acupuncture, go try osteopathy. But it's good that whole, it's growing.
I've got nothing to lose, so I thought I'd come here and see what you guys can do for me. I'm like,
But the people that we've co-treated so far, they've said nothing but great things from like the results that you guys have had. So that's really encouraging.
It's a small community too. This is what we want. We our main form of advertising is referral. So it's, if you can get the best outcome for the patient, again, it speaks for itself.
So with what would you say, what should a new patient expect from, like, say a new patient comes in, what should they expect when they come see you the first time, or see Bianca or your osteo?
So we do a thorough history at the start, and that goes into an assessment as well. As as a health practitioner, 80% of your diagnosis comes from the assessment, right? Or from the history itself. Yeah. So if we take a decent history from the client, we do an assessment, and again, we do a global assessment of the body, and then we try to narrow it down into the area that's going to be causing most of the problem there. And we also comprise a treatment plan for them. And treatment can be soft tissue work, mobilization, stretching, joint manipulation, and most importantly, corrective exercise. Another big thing that I feel is the main healing aspect of a treatment is education. If you can educate the patient on what is happening to the body, why is the body doing that? If you can educate them on that, I think that's one of the major hurdles for them to get over to be on that road to recovery as well. And it's one of the questions I ask all the time is like, do you know what's going on with your body? Do you know why this is happening? And more, a lot of the cases is like, oh, no, I think I've just got, the classic one is, your bursitis or tendonitis or something like that. But it's explained to them why it's actually happening. And trying to find that plan or treatment plan to get them through that.
Right. So you take a very thorough history first just to diagnose, because that's where that
all the information's in that history.
Yeah.
Again, you can mostly figure out what's happening just from even without touching, without assessing.
Yeah.
A lot of it's just from what they're saying to you. You can kind of put it together that way.
Yeah. And I noticed on your website as well, like I've seen some people say they get really great results from sciatica as well. Like how does osteopathy, what is that treatment process like for, say, something like sciatica?
Yeah, sciatic pain, super common one as well. So sciatic pain can originate from a few areas, from the lower back, through the joint, through the disc, or through the muscles there as well. So that part of the treatment is we don't just look at the spine, we don't just look at the muscles. We kind of integrate them together to get the biggest change out of it. So a lot of it is desensitizing that body, right? If you can desensitize that nervous system, by also using some manual therapy, some hands-on techniques, but also the corrective exercise, or informing them of what they should or shouldn't be doing to help manage that condition. And again, there's no magic buttons. I can't push or crack or magically take that sciatic pain away. Educate them of why their body's doing it, why the nerve's sensitive, and generally the prognosis or how the pain's going to go away. It gives them a sense of ease. It gives them a sense of power of like, oh, okay, I know what's going to happen to my body. I know what to expect. And then the outcome usually is a positive one if you can get through to that.
So sciatica, so it's very interesting, because prior to meeting you, I think it was Kelly. Kelly said, "Oh, I've got a great osteopath." I'm like, "Oh, interesting. What is osteopath?" He was like, and I can do Google's. That's fascinating, because I've never heard of it prior to that.
Yeah, right. Well, again, in osteopathy around the world is different. So osteopaths in the States, they are more, I think they go through medical school, and they go towards more kind of surgery. They can give injections, which we're not qualified to do. So in Australia, New Zealand, and most parts of Europe, it's all a lot of manual therapy or hands-on techniques. So we have our own either colleges, or we go through the universities here. So in Victoria, in Victoria and Sydney, there's a lot of osteopaths. In Queensland and other states, there's just not that many. There's just not that many. So I think that's why, I've been there for 7 years. I've been in Brisbane for 7 years, osteopath for 7 years. Weekly, every week, there's someone that will be like, I've got no idea what is osteopathy. We get a phone call saying, hey, I've got a sore back, I've got sciatic pain, being told to see an osteopath. What do you guys do? Yeah. And that's the whole point of trying to explain, in relatively layman terms, is like, we treat the whole body. We don't just treat your lower back. We kind of treat everything to see what can be contributing most to the pain.
Right. So you probably find yourself on repeat 16 times a week, saying the same thing.
A lot. Yeah. All the time. It's all the time. Yeah. You kind of have, you want to explain to them exactly what, go through the principles of what osteopathy is. Yeah. But really, they don't want to hear that. They just want to hear, what difference are you to if I go to the physio or if I go to the chiro? Where does osteopathy sit inside of that? And that's where I come down to that main principle, is that the body is a unit, or the body is a whole. It works together as one. It doesn't, sciatic pain comes from the lower back, but it may not be the lower back that's actually failing. Something else could be contributing to that. Yeah. And that's why we, it takes a little bit longer through the sessions. It's not a quick session, but it allows us to get a full understanding of how that person's body works.
Yeah. Okay. And right now, you said you recently hired a new osteo as well?
Yeah. So we got Dr. Jess. She's coming on full-time with us.
Oh, awesome.
At Osteopathy, which is exciting. Yeah. So she was working at another clinic down Alex Hill's way, but she's decided to stay in Bulimba now. So yeah, super excited.
Oh, okay. Oh, that'll be good. So it's you, your new osteo, and Bianca as well.
And Bianca, yeah. She's still on mat leave, so she only works occasionally. Okay. But she's hopefully, within the next 6 months, depending on what the current situation's like, she'll integrate more into the clinic.
Yeah. Oh, so you guys are you treat everything holistically. So, and that's sort of differentiates you guys. And you guys do manipulations, or you don't do
No, we
manipulation?
do. Yeah, yeah, we
Oh,
do.
okay.
We do. Yeah. So that holistic approach or full body approach to treatment is,
Mm.
yeah, we do the soft tissue work, the joint mobilization, tissue mobilization,
Right.
stretching work, the HVLA, which is the manipulation as well. So
Okay.
um, that's where, but we don't primarily uh, stick to just this. We don't just do the spine. That's the whole
Mm.
point of that
Right.
is a
Okay.
part of treatment. It's not the
Right.
whole treatment. So,
Right.
and that's the difference between one of the main differences between chiropractics as well. Chiropractics, a lot of their methodology is treatment of the spine affects the nervous system that
Mm.
can
Mm.
create a change somewhere else. So,
Mhm.
yes, that is part of what osteopathic medicine is, but it's
Mm.
not the only thing there. We use it as a tool. Um,
Right. Okay.
yeah, so some people respond well, some people hate it. So we see
Right.
both sides of this.
Right. Okay. And that's what you mean by holistically. You treat the whole person, not just the spine, not just the arm, the
That's
leg.
absolutely.
Okay.
That's the best way. We kind of put it all together rather than
Yeah.
massage therapy treating just the muscles, chiropractics treating just the spine.
Right.
We kind of bring that all together, which is where people really get the benefit.
Yeah. Oh, that's exciting. I mean, where do you see your clinic going in the next 5, 10 years?
We still want to keep it relatively small. So we
Yeah.
still want to keep
Personable.
yeah. Just again, we have a little bit longer appointment times.
Yeah.
I just hate the feeling of being rushed and trying to push people out
Yeah.
and having that factory type setting. So
Yeah.
we want to keep it small. We've just got the three of us working at the moment.
Yeah.
I think we'll keep that going once
Yeah.
Bianca comes on board.
Awesome.
But yeah, we're not trying to take over the world yet.
Well, it's good. It's good to have that personal feel, Balimba, Hawthorne area as well.
Yeah, it's such a community base here as well. It's
Mm.
that small little pocket, and again, people talk. So
Yeah.
if you're good at what you do, if you're committed to actually making that person better,
Yeah.
that's how you get a name for yourself to, hopefully for that referral to go on.
Yeah, and I really appreciate you taking the time out from your busy day to come and talk and do this
No, not a
interview
problem.
as well.
No,
So
more than
if
happy.
people want to learn more about you and what you guys do, what's the best place to find you guys?
Yeah, so a lot of our stuff is through our website. So www.osteoplace.com.au. We've got all the information up there. We've also got the book online feature. So um, a lot of the time we answer back emails as well. Social media through Facebook. We answer some stuff. We post stuff intermittently through there also. But we're relatively prompt. So again, we get a lot of people just asking questions about what
Yep.
is osteopathy and what can it do for me. And I'm more than happy to answer those as well. So if anyone's got questions, send me through an email or get in contact with us and I'll be happy to help.
Cool, great. Thanks a lot, David. Thank you for the time.
Awesome.
All right,
No
we'll
worries.
talk
Thank
soon.
you. Cheers. Bye.